Welcome to another episode of the Client Experience Architect podcast. I'm your host, Zach Hoskins, and it is my passion to guide you through crafting unique experiences for your clients to help you both maximize the value you bring and create a sales force of ranting, raving fans out there promoting your business. It is my pleasure to bring to you businesses who are crushing it with intentional customer-centric experiences and dive into what that looks like now, what it has looked like over the life of the business, and what it will look like in the future of their business. My goal is that you can snag some valuable insights to implement into your business after listening. Let's dive in. On this episode, I sit down with Dr. Luke with Command Family Medicine. At Command Family Medicine, they believe that when you are sick or injured, you need to see your doctor. Even more so, they believe when you are well, that you need your doctor to have time to teach you how to stay well. They are part of a cutting-edge movement called Direct Primary Care. Dr. Luke dives into how that works and how he is creating experiences for his patients to continue to grow his practice and transform more lives. And I'm excited to share this one with you guys. Without further ado, here's my conversation with Dr. Luke. Dr. Luke, well, thank you so much for joining me on the podcast. It's an honor to have you on.
Thanks for having me.
Of course. So let's begin by diving into your background and tell us a little bit about your practice and what you're doing here and what it looks like in the future.
Yeah. So my background, actually, I went to undergrad in Springfield at Evangel, went to medical school out in Southern California, came back, did my residency at Cox at their family medicine program. And when I started there, I pretty quickly found out that family medicine wasn't what I wanted it to be or what I envisioned. And I wasn't planning on doing primary care at all. I was just going to go work in ERs and urgent cares probably just to make some money. But the primary care environment typically is not very friendly. You don't get to spend much time with your patients. You're in there 5-10 minutes tops, and patients need a lot more time than that majority of the time. And I didn't like that people were waiting hours to see me, that was taking half their day just to come into the doctor's office, and then they weren't getting hardly any time with me. And then I found out about direct primary care through my cousin Josh Umber. He's in Wichita, has a clinic, Atlas MD, and talked to him for 30 minutes beginning my residency, and then I was sold. And from then on, throughout my residency, I was planning to start my practice, Command Family Medicine, which I started about 5 months out of residency. And so with direct primary care, we just charge our patients a monthly membership, like a gym membership, so they can have better access to us. They don't have a barrier of having to pay a copay or use their insurance. They're members, and so if they have something come up, they can text me, they can email me, they can call me. For acute issues, usually we can get them in same or next day if they need to come in. And then their appointment time is their appointment time. So we don't double or triple book appointments. You're not spending hours in the waiting room, 5-10 minutes tops if you're waiting at all. And then for appointments, established patients get at least 30 minutes and new patients get an hour to hour and a half. So we can really dive in, get to know the patient, get to know their history. And then on top of that, with increased access, we can also do medications and labs at wholesale prices, so we can save people a ton of money. If people are on any regular medications at all, if they have diabetes, high blood pressure, things like that, we can save them a lot of times more than what the membership costs them in their medication savings and lab savings, usually 80-90% less. And then procedures we also do at wholesale prices, so whether it's an injection or a biopsy, things like that. Some tests we include in the membership, so like rapid strep testing or urine testing, those cost hardly anything, or EKGs. They don't cost us very much at all, so we don't even charge for those. Or things like stitches that can be $3,000 in the emergency room. We just charge what our supplies cost, which I think is around $12. So.
Wow. Well, so it sounds like there's a lot of unique ways that you interact with your I guess your patients, and there's a lot of, and due to this setup, there are a lot of touch points that you can, maximize on. So tell me a little bit about what touch points are most important in your business.
I think, for us with, our patients having access to our cell phone and email, that's probably the most important, that they get responses from us quickly, so they, that we're not advertising that they can access there and then we don't respond to them for a couple days.
Sure.
So trying to make sure we, and some days, some days we're seeing a lot of patients in the office and so it's hard to get back to them quickly, but generally, within an hour, trying to text or email them back and get them answers set up quickly or get them appointments. If we do need to have them come in, that's probably the most important one, that or when they call the office.
So how do you have a system that helps you keep track of all of those texts and phone calls and emails, or is it kind of just like a normal setup and you just try and manage it all?
No, we use our electronic medical record is called Atlas MD, especially my cousin's medical record he developed specifically for this type of practice.
Oh, wow.
And so we utilize that, and it's very smooth. It integrates our cell phone number into the chart, so we actually get a Twilio number through the EMR, and then the patients text that number, and that gets forwarded to my cell phone. But
Gotcha.
then that documents all the text messages in the system. Same thing, has their emails synced in there, so if they're emailing me, it goes into the chart. And obviously it doesn't record phone calls or anything, but it'll tell us if the patient called or we called the patient.
Sure.
But it saves a lot of documentation time that way.
That's awesome. So aside from those touch points and kind of trying to maximize those, what are you currently doing in your business, towards your patients, towards patient centricity to ensure, that their experience is, optimized?
Well, one, we keep things smaller. So, I'm not going to allow my patient panel to get to 2,000, 2,500 patients like a typical primary care office will. That's why it takes forever to get in to see them, and you can never get a hold of them. So I keep my patient panel, like I said earlier, my patient panel right now is about 400. You can, other docs that have been doing this for a while as well. Kind of the sweet spot is 600, where you can make a good living, but you still can be able to do what you advertise.
Gotcha.
So that's probably one of the key things, is keeping the patient panel size smaller so you can do that.
Sure. No, that makes sense. So how do you know who your ideal client is or patient, or who would be the best, fit for your practice?
Yeah. So really everybody can benefit from it. I think it's just getting them to understand how to utilize it, because most people are so trained that you have to use insurance for any healthcare related issue, that they hear about this is like, what? I have insurance. What do I just not have it carry insurance? Or and so basically what I tell people is that it allows you to just use insurance as insurance. Like health insurance, what it's become in America, is not insurance anymore, because you're insuring things that you can expect to happen. You don't use your car insurance to buy new tires or to get oil changes. You can expect those to happen, just like you can expect to use primary care and have preventative maintenance, or go to the, get urgent issues when you get sick or injured taken care of. Most people can expect that to happen, especially if you have kids. So really our ideal client is somebody who understands that and switches to a catastrophic insurance plan, so they're covered for just the unexpected. Just like you have on your house and your car, you have the insurance for the unexpected. You don't have it to cover the day-to-day stuff. And so and another class kind of within that is the health sharing ministries that have become a lot more popular since Obamacare started. Those have really benefited us, because the premiums are a lot lower for that, and that covers catastrophic coverage easily, and then they can utilize us for their primary care, where they'd be paying out of pocket for primary care anyways with the health sharing plans for majority of those companies. And so what our clientele kind of is broken out to is we get a lot of young families that have young kids that hate wasting a weekend in the urgent care, and we can save them those trips pretty easily, for ear infections or strep throat or minor injuries. And then Also, middle-aged adults that are maybe in their 40s, 50s, pre-Medicare, that have diabetes or high blood pressure and need regular checkups, regular follow-up, but maybe don't have insurance or have high deductible catastrophic insurance, and need to stay on top of those chronic issues.
Sure. So what are some ways that you're educating those, that patient that, is that typical, like, I've grown up this way, this is how, this is the insurance way, I don't really want to change my mind. What are some ways that you're kind of, educating that?
Yeah. And so we do a lot of radio ads. And so we're constantly out on the radio, kind of making those, comparisons, like what I mentioned with the car insurance.
Sure.
So we're constantly putting out there in the community, or we do advertising with 417 magazine. We're constantly getting the word out about how it works and why you don't need to use health insurance for primary care.
Gotcha. Okay. Well, good deal. So let's dive into some feedback. How do you, obtain feedback from your clients, and then do you have a system of putting that feedback back into your business and implementing that?
Yeah, so that's an area we probably definitely need to improve on. We don't have necessarily a set structure where, if we're sending out surveys or those kind of things, it's mainly feedback we're getting from patients as they're we're touching them, basically.
Sure.
When we're texting them or emailing them or talking with them,
right?
And figuring out which things are working well or not working well. So I think that's definitely an area that we need to improve as we're growing, to be in better communication with our patient population, figure out things that we can do better as we grow.
Sure. No, it sounds good. Okay, so taking a step back, we talked about touch points, the important touch points. Aside from the touch points, what do you think is most important to your patients? Like, aside from the touch points, or what do you think is more important or most important?
I think especially with a membership model like we have, you have to have high value to that membership. If people don't feel like they're getting more out of the membership than what they're spending, they're just gonna cancel.
Sure.
If they feel like they're not getting anything out of it. And so we're constantly trying to find ways, new services we can add, or better ways to help patients with whether it's losing weight or different things like that, reversing diseases. We're constantly trying to improve ourselves to improve the value of the membership, so that it's a no-brainer for people to continue.
Gotcha. All right. Well, good deal. So let's kind of take a look into some of the personal, your personal life. So what's been one of your favorite challenges or failures that you've faced in your life, and how has that actually set you up for later success?
One of my favorite challenges or failures. Probably, when I was applying to medical school, initially I thought I was going to go to Kansas City as an osteopathic medical school. I thought that's where I was gonna end up.
Sure.
And I had a letter of recommendation from vice president of the board, but then my interview went horribly. It was really awkward, and I don't know what happened, but I interviewed at medical school in Southern California, and it went really well, and they accepted me a couple weeks later. And at first I was real bummed, because I thought it was supposed to wanted to be in Kansas City. My
Sure.
family's in Kansas City. Seemed like a great school, and then I ended up getting waitlisted there, and then that's when shortly after that I found out I got into Southern California.
Gotcha.
Med school, Western University. And I think that I learned a lot more about myself and how I work best and function best from that school. I was able to made a lot of great friends out there that I would have made a lot of great friends in Kansas City too. But
Sure.
I think that I was really thankful that it didn't work out the way that I had planned.
Sure. Okay, so what advice would you, let's go back in time for a little bit. What advice would you give your 20-year-old self?
I'm trying to remember where I was at when I was 20 years old. I would probably tell my 20-year-old self to read Rich Dad Poor Dad. I wish I had read that when I was much younger, and to get a better hold on finances and
Sure.
and wealth building. It's something that I wish I had understood when I was that age, and I had no idea. I was just had debt from undergrad, and then I was just piling on debt from medical school, and had no strategy, besides obviously, becoming a physician to pay that off. But I wish I had, when I was younger, before I started accumulating that debt, that I would have started some wealth building strategies much earlier on.
Gotcha. Makes sense. Where did the name Command Family Medicine come from?
Yeah. So the name, initially when I was planning on starting my practice and trying to come up with the name, I thought it was going to be much easier than it was, but it took me a lot longer and it was a lot more difficult to come up with a name that I thought fit and felt right. And so Command kind of has a three-part meaning. So three or four, I guess. With our patients, we're helping them take command of their healthcare in the current healthcare environment. Patients don't really have any control. Their insurance company tells them where they have to go to see, who they have to see for their primary care provider, what hospital systems they have to use, what medications that the insurance company will cover, and what procedures they'll cover. They don't have any control. It's all third-party control, and so we're trying to give control back to the patients. We're always telling them what our costs are going to be to them if it's a medication or a lab that we're doing, or if we're referring them out for any other procedures or imaging. We always are trying to make sure we find out what they're going to pay before they go do it. So instead of the typical, like, you have no idea what's going to cost until the bill comes 3 to 6 months later, and then you get multiple bills over that, and it's just a mess. So we always try to make sure the patient knows up front before they get the procedure done, or before they have a service from us, what that's going to cost. And then we're also giving providers, physicians, control of their practice, helping them take command of their practice, so that they're not rushed through patient visits. They're not told how many patients they need to see a day. They're not told who they have to see, things they can and can't do, giving autonomy back to the providers.
Sure.
And then also as a Christian, our overarching theme, how we treat everybody, is we're following Jesus' greatest commandment. So it was kind of the three-part.
Very good.
Meaning there.
Well, thanks for sharing that.
Mm-hmm.
So are there, what's one key takeaway from our conversation, or from what you've seen in your practice, that our audience can implement in regards to client, customer, or patient experience?
So from what we do, I think just being available to your clients. Patients love that for us, that they can talk directly to me, and not having multiple layers where it takes forever till you got to talk to the secretary, then you got to talk to, then they have to talk to the nurse. The nurse has to call you back. You miss the call. You call the nurse back. They miss your call.
Yeah.
And it's a mess. And so I think allowing people to get a hold of you quickly and responding to them quickly is key. It's the worst when you're trying to set up a meeting or something, and that people never email you back, or and then eventually you're like, well, I'm just not going to deal with them anymore because I don't know when they're going to get back to me. So
Right.
being able to be reliable and know that that your clients are going to be hearing back from you quickly.
Yeah. Well, definitely make yourself available, guys, as you're listening to this. Think of a way that you can, make yourself available to your clients and take that key takeaway. So Dr. Luke, are there any exciting projects or new things that you have coming up that you'd like our listeners to know about?
So we do, primarily we do direct primary care, the membership services, but there's some things that I've discovered in just figuring out how to add value to my practice, things that I really enjoy doing, that we're going to start marketing outside of the membership as well, that will be able to offer specifically a service called prolotherapy. It's a type of injection that actually it's very affordable. It doesn't cost very much to do, but it actually helps initiate healing in joints, tendons, ligaments that we inject. And so we've started doing that in the clinic and been educating myself and been able to help a lot of our members. We're charging them hardly anything because the supplies don't cost much, but I really enjoy doing that, and it's a service that I think there's only one other clinic in town that's doing it, just with how heavy we are with hospital employed practices. And so I think that's a service that needs to be expanded and allowed other people to benefit from it instead
Sure.
of getting maybe surgeries unnecessarily when they could be doing this, and help take control of their pain, where instead of they're used to going to pain management, and just putting a Band-Aid on it,
Sure.
taking pain medication or getting injections that help with the pain but don't heal anything, where we
Yeah.
can offer this. And so that's one thing that's coming up that we'll be starting to roll out to offer to non-members.
Very good. So it's like fixing the well instead of the sink. In a
Right,
way.
right.
Instead of putting a Band-Aid on it, you heal the original source. Good
Yep.
deal. So how can our listeners get in contact with you or the business if they want to follow and kind of keep up?
Yeah, so on my website, command.md, it has my email right on there, and the contact us form goes right to me. But my email is also drluke@command.md, dr.luke@command.md. That's probably the easiest way.
Perfect. Well, Dr. Luke, it's clear that you're passionate about how your patients experience your business, and I thank you so much for taking the time to share that with us, and I appreciate for taking the time to be on the podcast.
Yeah, thanks a lot. Thanks for having me.
Of course. Thank you for listening in on another episode of the CX Architect Podcast. As always, we would love to get your feedback on this episode and other episodes. If you liked it, if you pulled out any nuggets to implement, things like that. If you like this episode and are listening on your phone, take a quick screenshot and post it to Facebook or Instagram. Let me know what you thought, and then use hashtag CXArchitect and tag me in it so I can see your feedback. You can also head over to clientexperiencearchitect.com/podcast to find the show notes and a place to leave some feedback. Please let us know what you'd like to hear more of. And if you like the show and believe others might benefit from it, we'd love it if you share it up and leave a 5-star review on iTunes. Doing that will help more people discover the show. And with that, I appreciate you and thank you for listening. Have an awesome day.